Welcome back to East Texas Now. We are going to take a look now at the second part of my interview with Dr. Tia Johnson, the childhood and adolescent psychiatrist at UT Health East Texas. In this part of the interview, we are going to talk about what exactly teens and parents can do to help mitigate some of these negative effects that are reported from social media use in the absence of a nationwide ban, similar to what they have in Australia. So let's go ahead and take a listen to part two of my interview with Dr. Tia Johnson.
So we've talked a little bit about now the social media ban in Australia, and now I want us to talk a little bit more about what exactly can be done in the absence of a similar ban here in Texas or in general the United States. I found another study from Pew Research from last year on the mental health effects of social media use. And what they found was that teens aren't enthusiastic about talking with professionals. Only 31% of teens say they would be very comfortable talking with a mental health therapist, 31% not too or not at all comfortable. In spite of the expertise of experts like you, why maybe would teens be hesitant to talk to a therapist, do you think?
So I think that goes back to children not really, children nowadays not really knowing how to communicate well with people in person. They can text, they love using those acronyms for different things and those quick messages and things like that, but they don't know really how to communicate and have um um more long-standing conversations with people. And I think the thought of doing that makes them uncomfortable. And so that's why I think they say that wouldn't want to talk to a mental health professional about their issues. However, I do think that once the kids are able to make it to an office and make it to see a mental health professional, over time, once they gain trust in that person, those walls do end up coming down and they do end up talking pretty freely about things. But it takes some time to build that relationship, as to be expected. So that's not too bad. But the initial, I think, fear of children doing that is their fear of having to communicate with somebody in a form that they're not used to communicating in.
Now, another piece of data that I found very interesting is that teens are more comfortable talking about their mental health with their parents, but there's still a gap between parents and teens when it comes to discussing these issues. 52% of teens say they would be very comfortable talking with their parents about their mental health, but the other way around, parents talking to their kids is 80%. So, what advice would you give to parents who want to have these sorts of conversations with their teens?
It starts with building the relationship with your teen before they're even teens, right? It starts with relationship building when they are a child. It starts with talking to them every day when they come home from school, having dinner together. I know some families, sometimes it's really hard to do that. I get it with everybody's schedules and stuff, but trying to set aside time at least once a week to always have dinner with each other and just talk in general, just have conversations in general. That's going to build that relationship to where when things come up, because you have built this strong relationship with your child, when they have mental health issues, they are going to want to talk to you about them and talk to you about them first because y'all already have a close knit relationship that was built just on having constant communication from the time that they were young and growing up. And so even if you have a teenager now and you feel like, oh my goodness, I might be too late, I didn't spend time, start doing those things now. Start having those conversations in the car instead of just listening to music or them having headsets in and you driving, or if they decide to drive and you're just kind of scrolling on your phone. Put the phones down, talk to each other while y'all on car rides. Most car rides aren't super long. You can talk to each other for 30 minutes about the day, about how things are going, about how you're feeling, what's been going on with your friend groups and things like that. And then over time, try to build that into, like I said, trying to have dinner without phones, locking up phones completely and just spending time with each other. That's going to help make them become more comfortable with talking with their parents.
Now, what about teens? What can they do to protect their mental health while on social media? And before we answer that question, I do also want to mention a study that was published last year in JAMA, which suggests that doing a social media detox could reduce symptoms such as anxiety, depression, and insomnia among teens who use social media. Again, what can teens do to protect their mental health while on social media? And what would be your advice to a teen looking to break a habit like this, a social media addiction?
So I think taking scheduled breaks from social media, it will really help teens with their mental health. So not saying that you have to be completely off social media all the time, but taking breaks, taking a month break off of whatever social media platform that you're using at the time, or however many social media platforms. Taking a break for a month to where you're doing any and everything else but getting on social media, reading books or whatever. That's going to help protect you, just because you won't always feel the need to get drawn into that, into that space of being on a social media platform constantly, always needing to check it. And that goes along with too kind of detoxing as well, taking a break from social media. And during that break, in order for it to be successful, you might have to take the app off your phone or your tablet. You might have to, because I know with Apple, there's ways that you can put in there to where it limits your time on social media. And like, yes, you can, bypass it. But, if you truly want to get better and not have social media impact your mental health, you have to be disciplined enough that when it sets your time, and when it says your time is up, your limit is up for the day or whatever, then you let the limit be up. Don't bypass it. Go and do something else. I know that some research has shown that if you change the background to your phone, if you change it to black and white, to where it's not colorful, it's less interesting in using your phone. So putting your phone on black and white, there's a way for you to do it on Apple to where you can make everything be black and white or grayscale, and that can help you use your phone less, because if you're not seeing all the colors and everything, then that decreases your the it makes it less enticing to want to stay on your phone when you don't have all those colors and everything. So that those would be ways that I would tell a teen to try to protect themselves and their mental health while using social media. Now, someone who wants to detox, you're going to need to delete everything, and I would actually recommend deleting all the apps off your phone, and also having a parent double checking behind you. Check my phone, make sure I'm not staying on this. Let them help you stay consistent in that until you have completely detoxed from using social media.
Right. Dr. Johnson, thank you so much for your time.
Thank you.